Hi, Sakis.
Hi, Konstantin.
What do you do here?
Oh, that's good. Actually, I visit this nice country.
Oh.
Yeah. I just came here. I'm invited to give a course about physiotherapy.
How you start to teach a PNF course?
Yeah, PNF course was PNF education was something which started early after I graduate from the school. So actually, the first course was held in Greece in 1996.
Oh, it's 1996.
Yeah,
It's
yeah.
first course.
Yeah, my first course PNF, and then I like it a lot because, you know, from the school I had a different idea about PNF.
Yeah.
You know, the teachers in the school, they weren't certified teachers in the PNF, so they are learners from the books.
Oh.
But you know, learning from the book is totally different story.
Yeah.
It's an old fashion,
Yeah.
has nothing to do
It's
with
not funny.
It's not funny.
Yeah.
Not funny at
Not
all.
funny.
Yes. Has nothing to do with the current evidence. Has nothing to do with clinical reasoning. Nothing to do with what we are doing nowadays. Yes. I mean, then I really realized what is PNF and how useful it was for my clinical practice. I can treat almost all patients with PNF. Yes, because you know, in PNF we have a lot of skills. We have a lot of, we have the famous patterns, but patterns from different positions, patterns which are modified to different conditions with patients.
Yes.
Mat activities, we have gait training, we have vital functions, the range of the conditions in which we can treat in PNF are really very huge. You can treat orthopedic patients, neurological patients, rheumatology patients, elderly people. Yeah, internal medicine. There are numerous of patients who can get benefit from that.
What about evidence in PNF concept?
Yeah, that's still a story, you know, the evidence with every concept.
Yeah.
You know, the evidence in PNF, first of all, we have a lot of articles. Has been for many years. If you look in the literature, you can see a lot of evidence, a lot of papers, many. The problem, of course, is that because, you know, all these studies vary in relation to different patients with different conditions. In nowadays, we can say that PNF is evidence-based, but the limitation comes from the point that it's treating a big range of patients. So, you know, from that point, it's very difficult research all these conditions, all these different patients, and then to make a general conclusion that PNF concept it's evidence-based. But I want to share with you experience I had with my PhD, because my PhD was based on the PNF, PNF and arthroplasty. And I remember the time I was scheduling the methodology, I had many problems with the teachers from the university, because they asked me to be very strict on the methodology. So I had to use certain techniques. I had with a certain amount of repetitions, and everything should be the same in all patients. And so it was horrible, because you know, in PNF, I mean, the benefit of PNF is that this assessment and treatment comes together, and based on a very strict rule of clinical reasoning, which, you know, sometimes in the research this is missed. So from this perspective, it's very difficult PNF to fit in a strict methodology. You know, it's very easy to do this with, let's say, with the modalities. So because it's one thing which can apply to everybody. It's very easy to do with an instrument. It's very easy because then the same thing it's applied to everybody. So with a PNF, it's very hard. Yeah, and of course, I think that you know, sometimes there is a discussion about evidence, and yeah, we have to decide finally when a concept becomes evidence-based. This is the other thing, because you know, how many articles how many LCTs to prove that a concept, an idea, a method is evidence-based. I think that two characteristics should be fit to that question, if something is evidence-based or not. The first, the concept and the idea should be in the line of the basic science, biology, anatomy, biomechanics, pathomechanics, and on the other hand, it should have some evidence, of course. Some papers which prove, if not at all, but in subtopics, that what we are doing is really has a valid. Because we have to prove, nowadays we have to prove what we are doing.
Yeah.
But I think that now in the PNF Research Committee from IPNFA, the people there, because I was a member of this in the last 5 years, the past 5 years ago, and now they do a very good job because they promote PNF research in the best way, so new articles are coming, and I think that all this climate about that some people have doubts about PNF and evidence-based is going to be changed.